Mask, hand sanitizer, Clorox wipes, all things that we keep close by as this pandemic wages on. And all of our COVID-19 protections meant fewer cases of the flu this year. But as more of us get vaccinated, some people are starting to let their guard down. And as Wink News health and medical reporter Veronica Marshall shows us, that has doctors worried that we could be in for trouble this next flu season.
This flu season, fewer patients walked through Dr. William Bentz's doors looking for help.
Everybody was preoccupied with the COVID-19 virus, so we actually probably had less flu questions this year.
Despite the lack of focus on the flu, cases, hospitalizations, and deaths went down.
It's been significantly reduced compared to previous years.
In fact, nationally, the last time we saw numbers this low was 2005.
There was so much anxiety related to COVID that if someone had those type of symptoms, they sought care sooner.
Charlotte County's Department of Health officer Dr. Joseph Pepe says that early treatment lessened the flu's impact.
When the hospital systems are stressed already from COVID, the last thing you want is another outbreak to add to that.
There was a lot of concern for the twindemic. We are extremely fortunate that it did not happen.
But UF Health Infectious Diseases Dr. Kartik Cherabuti says this year's unusually light flu season also comes with unfortunate consequences.
What we use in the vaccine is previous year's strains. What strains are we going to use in the next flu vaccine? What does this mean for immunity for elderly folks who've not had or any exposure to the flu over a year and a half?
Dr. Cherabuti recommends vulnerable and high-risk people mask up next flu season.